we use radiation to kill cancer cells. Okay, to fight cancer, actually, it's a group of it's a teamwork, and it consists of mainly medical personnel and also non-medical personnel. And for the medical personnel, it involves surgeons, radiation oncologists like me, and also another group of people, a group of doctors who work with drugs, medicines, and they are called hematologists. They are a branch of internal medicine. Okay, so they specialize in chemotherapeutic drugs. Okay, and I work in the field of radiation oncology department, and we use radiation machines. For now, it's the most popular machine is called a linear accelerator, and it produces X-rays, high energy X-rays, and that can damage the cells, normal or cancer cells, but it's just how we know how to regulate, how to focus on the tumors and protect the normal cells being damaged too much. Actually, the new technology that comes out, it has to be tested first, to be really act out on the human subjects. Yeah, and from the patient's point of view, of course, they want what is best for them, what's the most effective treatment for them. They also tend to rely on what they know, what they are exposed to. Okay, for instance, in the Chinese culture, they heard a lot about Chinese traditional herbal medicine, and that's the part that's one that also like to talk about, or they hear somebody talk about. And of course, from the patient's point of view, they just want something that is good for them, that can help them. And if they heard someone who says, oh, this herb is good and it will probably kill your cancer, and they probably will go ahead and try it. But if a new technology comes out and it is approved and it's widely used, and it's established as a real good treatment method, and of course they were just accepted as well. Mm-hmm. Yes.
So, I mean, for this type of drug to become, like you say, established, what is normally the regulation process that it has to go through? How many years does it take to get from the research to the practicality of it?
Yes. Well, like I said, I am a radiation oncologist. I'm not a specialist on the drug field, okay? But what I can tell you, what I know, okay, for a drug to be marketed or to be approved, it goes to a long process. Okay, first of all, a drug is discovered, okay, and they have to test it on the animal subjects first. Okay, they first when they test on mammals, they used animals because they don't want to first test it on human being. What if it's toxic? What if it causes harmful effects or death? Then they cannot be responsible, or it will be so bad that it will be a disaster. So they use the animals to test it on first. And first they test on the animals to find out if this new drug is toxic, if it's really it will bring on many side effects, or if it will harm the animals. Okay, if it is too toxic, then they probably won't go on to experiment with human subjects. Okay, and also on the animal models, they will see how the drug work, how its property and how it's excreted from the mammal system. But the most important thing is that they find out if this drug is toxic or it's really good. Maybe it also do what the drug is supposed to do. Okay, and if they pass the animal testing, then they go on to human testing. Okay, and for the human testing, it involves many also many stages. There are actually four phases of study on the human subjects. The first three you have to pass before you apply for the FDA approval. Yeah. Okay. And for the first phase, and you just get healthy volunteers, healthy human beings, and then you give them the drugs, and then you study also on the effects of the drug on human beings, like the property of the drug, how it is excreted from normal human. Is it metabolized in the liver, or it comes out in the urine? And what will be the effective dose to treat certain disease, or what the effective dose that can bring the good out of this drug, and is there any also side effects? They will study on that. And then if they pass the first study, then they go on to the second. That's called a phase 2 study. The phase 2 study, they use more subjects, human subjects, not only a few volunteers. They use a larger population, okay, to see what is the probably the rate of effectiveness, like 100 people, and how many of these 100 people will bring results or bring out the effect of the drug, something like that. Okay, yeah. And on the phase 3 study, then they use placebos, a substance that really doesn't contain medicine or any medication effect. Okay, probably some pills that is only made of cornstarch or something that doesn't bring any effect. And they compare the drug with the placebo, and to see if it really the drug is effective as it thinks to be. Yeah, against the placebos. Yeah, and if it's not as good as the placebo, and you say, oh, this drug is actually, it doesn't bring out positive effects, so probably it will do not much good. Yeah. Okay, this is a really big question, because we want to be healthy, okay, and we cure disease, okay, but probably there are many aspects of how you perspective of how you look at this thing or this question. Do you want a healthy person to live longer than he is supposed to be? Do you want to fight against aging, and then or even live on forever? If you do this, then it will have a tremendous effect on the society as a whole, not and the world, not just the person.
Do you think it's more positive or negative, or in your own opinion?
I will tend to think that if every healthy subject is able to live longer than he's supposed to, then probably eventually in the future, probably the world or the earth itself cannot take that much. You know, we spend all our resources in the rate. You know, it is can be accounted. Yeah, so probably there's not so many resources left for that many people to use. Yeah, but in my field of medicine, we don't expect people to go live on forever. We just want to help people to fight against disease. Yeah, and of course, this if you fight the disease, if the disease cured, of course you can live longer, right? But still, there is the natural process of aging that will take people's life, and I think I will tend to favor the natural way of dying. Yeah, but you know, some cancer is curable, and some eventually also will go on, and then people will die in a natural way. Yeah, and of course, medicine tend to prolong people's life, but to a certain extent. But I don't think to extend it too much is good for the world as a whole. Yeah, in the past, well, the human lifespan has become longer than the past. In the past, you can die from any infectious disease, and well, there are some revolutionary finding in the field of medicine, such as like antibiotics, yeah, that can even stop the spread or cure someone's infectious disease, something like pneumonia or TB, like you mentioned, yeah, and then that can be like you can say like a step, a very giant step toward prolonging life, and yeah, inevitably, I guess in the future, you know, they will try to find some drugs that defies death, but I think the environment and the globe has to take this consequence on its own and the globe evolves also naturally. You know, if you prolong everyone's life like that, if you defy death, then there will be more people on Earth to feed, to use the resources, and it will change the globe eventually also. Probably the nature will have its own method of eliminating, yeah, too many subjects or too many people on Earth. Probably the nature will take its own course. Well, it's basic research. Yeah, we know a little bit, but I myself is not involved in the basic research. I do clinical work, yeah, most of the time. There are doctors who carry out also basic researches, yes, but I myself is not very familiar, okay, yeah, with this sort of study. Yeah, most of the people, they fear death. I don't think there's no one who welcomes death, right? Because it's a big change. I think basically, us as human beings fear what is unknown because we don't know about death. Nobody comes back from the death and tell us, oh, what is on the other side of death? What is there? Well, what if someone comes back and tell us, oh, there's another whole world different than what we have now, and it's even better and it's even more beautiful, and we go to a different planet or such things, and then we'll embrace death. But because we don't know death, and we don't know what will be going on after death, so I guess that's the reason we fear it. Yeah. But eventually everybody dies, and everybody it's inevitable thing for us to go through. But if we think of it as natural process, it's a road that we go down, and if we believe that it's a path toward probably another thing, because many religions, they also teaches you, you don't have to fear death, because death itself is probably has another it's another probably another a part of life. It's a part of life, and after that you probably find another probably your soul will rest in some other space. Yeah, or there's another religion that says that after that you will come around again, and then reincarnated, or reborn. So that will also help people to overcome the fear of death. But generally, of course, if when you face cancer, people are afraid, and are afraid that that their cancer disease cannot be cured, and eventually they will die. Of course, they will be afraid, and they want to fight,
Right.
to live on. That's complicated because, well, you have to do a large-scale survey.
Sure.
Yeah, to know how many people, if they don't get cancer, but they will fear death. How many cancer patients? Because it also involves age. Okay. See, if you are young, and you get cancer, and of course then it will be more unwilling to die from cancer, because you are young, you haven't lived your life long enough to see the world, or to see your children grow up, to do the things, to accomplish the things that you want to do. Of course, when at that age, you don't want to die. But if you are an old person who gets cancer, say like if you are in the 80s and you get cancer, and then you said, oh, I've lived long enough, it's enough for me, I don't want to live anymore, I can die, so I don't waste any more resources, or I don't want to demand other people's help, or demand on their attention and things like that. So different people will have different perspectives. Well, actually, cancer is a very complicated, very complicated disease. It can be caused not only just one cause. It cannot happen. It probably doesn't happen just because of one factor or one cause. Yeah, it involves many causes, or maybe it's destined in your cells. It is related to the environment, your genes, what you eat, and what you're exposed to. Yeah, all sorts of things that add up together to have the cancer cell growth. So some part, yeah, it is true. Probably there's something wrong with the cell's telomeres or telomerase activities that will cause the growth of the cancer cell. Or maybe it's just simply a genetic defect, a chromosome defect that causes the cancer to grow. Yeah. So one drug probably is not, probably it will help one person, one patient, but probably not the other, because you don't know what exactly it will be something else. So what we do also in the field of medicine, the hematologist, the doctor who gives out the drugs, it also gives out the drug by the way that, we have many chemical drugs that is also long established, that it says, okay, this kind of drugs will help colon cancer. And so they use it. It helps most of the patients. So we use that first. Okay, we use that. It's a standard treatment, so we use that first, and probably it will stand the test for a few months, and then it will expire. It will stop to bring out the effect, or the cancer comes back again. Okay, we do the testing to see if the cancer comes back. We follow up on the patient. Or we'll say, oh, this kind of drugs seems effective for a period of time. And then, the cancer comes back. Then probably this kind of drugs is no longer useful. Probably the cancer itself develops some kind of anti-drug by itself, then it becomes ineffective. Then we use another kind of drugs that is not as standardized as the formal drugs. Then there are so many drugs to be tested on. We use different drugs. And then there are also therapy that's called target therapy. Target therapy, there's new drugs that works on the receptor of the cells. And then we block the receptors, the certain types of receptor, and see if that works.